The Nunavik Health Survey, Qanuippitta, how are we? As you may already know, the Nunavik Regional Board of Health and Social Services is undertaking a joint health survey among the 14 Inuit communities of Nunavik with the Institut National de Santé Publique du Québec and SHUQ's Public Health Research Unit. The 2004 survey is a follow-up of the survey conducted in 1992. Its goal is to assess Inuit health and risk factors. It will also be used to help plan programs and services to prevent heart disease, cancer, anemia, diabetes, and other health or social problems such as suicide and violence, and to improve lifestyle habits and nutrition. 600 households or 2,700 people will be asked to participate. As in 1992, 4 major themes will be assessed: your general health and lifestyle, your dietary habits, your heart health, and your exposure to environmental contaminants. What you will be asked to do as a survey participant: you will answer a questionnaire during a face-to-face interview. The interview will be done on board the Edmondson icebreaker. The interview will last approximately 2 hours. It will include detailed questions about your lifestyle, health, and eating habits. During a clinical session, a research nurse will ask you a few questions about your health and will take a fasting blood sample. That's 45 milliliters or approximately 3 tablespoons. Measure your weight, height, and waist and hip circumference. Take your blood pressure. Perform a hearing exam. Take a toenail sample. Measure bone density for women between 35 and 74 years of age. Take your temperature. Give you a sweetened beverage to drink for diabetes screening and take a second small blood sample 2 hours after drinking this beverage. This step will take approximately 30 to 45 minutes. Blood analysis. The following blood analyses will be done as part of the survey: blood lipids, glucose, insulin, fatty acids, antibodies indicating past infections, environmental contaminants such as organic and inorganic compounds such as PCBs, heavy metals, and anemia determinants for women. Toenail samples will be analyzed for selenium. These blood analyses will allow researchers to determine whether you have normal or abnormal levels of blood lipids and diabetes or anemia if you are a woman, as well as gauge your exposure to past infections and environmental contaminants. Blood samples will be stored for 15 years at minus 80 degrees Celsius in freezers located at the Institut National de Santé Publique du Québec in Sainte-Foy, Québec. These blood samples will be the responsibility of the Nunavik Regional Board of Health and Social Services. Blood vials will be identified by a number only. Your name will not appear on them. These blood samples will never be used by any commercial or pharmaceutical companies, neither for genetic tests. Benefits. Participating in this survey will give you a deeper understanding of any health risks you may face and what you can do to reduce them. As a preventive measure against heart disease, diabetes, and anemia in particular, it will also allow you to verify your current health and make improvements as needed. Thus, if you are a woman and have anemia, if you have abnormal blood pressure, blood lipids, glucose or insulin levels, high levels of antibodies against past infections in conjunction with fever or a hearing problem, you will be sent a letter advising you to visit your local health center. The survey also gives you the opportunity to take part in a regional health survey and gauge the health of your community. Risks. The study should not pose any risk to you. You may develop a slight bruise where blood was drawn. Confidentiality. All information gathered for this study will be kept confidential. Information will be used for statistical purposes only, along with answers from other Nunavik households participating in the survey. Your questionnaire and blood samples will be identified by a number only. Your name will not appear on them. Your name will only appear on a master identification sheet that links your name to the numbers. These master sheets and the survey database will be kept under lock and key at l'Institut national de santé publique du Québec. Moreover, only authorized Institut national de santé publique du Québec, Unité de recherche en santé publique du CHUQ, Nunavik Regional Board of Health and Social Services, and other experts involved in aspects of the survey will have access to the survey database. Once the study wraps up in December 2006, these master identification sheets will be destroyed. Your name will not appear in any publication or report. Withdrawal from the study. Your participation in this survey is invaluable, but must be voluntary. You are free to withdraw from the study at any time without prejudice. You may choose not to continue even after you have agreed to participate. To withdraw from the study, please inform Nurse Suzanne Côté, the field coordinator, or any medical staff. Honorarium. You will receive a payment of $25 for your time and involvement after you have completed the survey. Those who complete the household questionnaire will receive an additional $10. You are welcome at any time during the survey to call the field coordinator, Nurse Suzanne Côté, or principal investigators, Dr. Serge Derry and Dr. Eric DeWhaley, to request more information, make comments about the survey, or withdraw from the survey. If you have any complaints, feel free to call Jeannie May in Kuujjuaq at 819-964-2222. Please direct any further requests to Ms. Suzanne Côté at 418-650-5115, extension 5277 in Quebec City, Dr. Serge Derry at 819-964-2222 in Kuujjuaq, or Dr. Eric DeWhaley at 418-650-5115, extension 5240 in Quebec City.